All right, hi everybody. So we're going to have a quick video on the health information management cycle. So what you'll see on the screen right now is the 5 general steps of the cycle. Steps can be even further simplified to kind of 4 different stages of health information management. Okay, and these stages are going to overlap with these 5 different steps. All right. Um, I like thinking about the stages a little bit better than the steps because it really tells you what is going on at different points and how things overlap. So, the first thing we're going to talk about is where information starts, where it's created or where it's received. And I say receive as in it comes in via some form of health information exchange. All right. So our first is the coding or the claim revenue cycle. Now you'll notice claim revenue cycle essentially links our first 2 stages directly. All right. The claim revenue cycle is going to start when the patient becomes a patient, right? So when they show up to their office and they say, hey, I want to establish myself as a new patient at this clinic, that is where all of this begins. That is where we first receive or create information related to that patient. So on top of that, we also use this information, both personal information that is classified as PHI, but also information that is gathered during their medical visit to then create claims and generate revenue. So really, when we talk about the claim revenue cycle, we're looking at the process of registration, but we're also looking at everything that happens with patient information after registration and what we do with it, because that is the actual billing and coding process. So essentially, you go through steps to verify benefits as needed. You're going to actually submit claims. You're going to handle claim denials, and you're going to essentially generate reports related to revenue at the very back end of it, right? And the cycle kind of starts all over again. You'll learn more about the claim revenue cycle depending on what program you're in. If you take the MDAA, I believe 204, but it could be 202. It's been a while since I have instructed one of those courses, but you will dive into the claim revenue cycle to a greater degree then. So the next thing we'll want to talk about is data analysis. Now, data analysis is exactly what it says. It means we're collecting information and then we're analyzing it. Now, in a way, data analysis encapsulates the entire cycle. Okay? We can analyze data related to every one of these 5 steps that you see up there, which is, again, this is why I like staging more than this idea of steps. Because we can, with the claim revenue cycle, we can analyze issues with claims. We can analyze predicted income based on trends in coding, right? If we suddenly have a lot more new patients, we can theorize that we're going to continue to have more new patients for a certain amount of time, obviously until our new patient capacity is full. But that can help us estimate income that will come in and helps the business side of things plan the future of the organization financially, right? We can also use data analysis, as we talk about in the early lectures of the course, to look at patient outcomes, right? We can actually open up medical records and use the actual medical information to follow trends and monitor progress. And that is actually a big part of things like accountable care organizations. So on the back end of things, where we haven't talked all that much of this cycle yet, we have our 3 steps that I like to think of as the most important part of how we actually use data. And that's essentially how we handle it, right? You have to maintain it, you have to protect it. Once it passes out of its cycle duration, meaning 7 years of retention for most medical records, once it hits that 7-year point, it can be destroyed. But processes related to destroying it need planned. They are an explicit part of the cycle. And then there's also some things that completely skip that destroy step, like the MPI that we'll talk about in a later week. The MPI should be retained permanently forever, so therefore it falls into this very last archive preserve step where we keep that forever, and it needs to be maintained forever. Data analysis can look at any issues that arise with these problems, right? If you have strong IT security policies in place, you'll be able to track and monitor everything that happens to these records. Data analysis is a big key in being able to help with risk management, which is another stage of the cycle we'll talk about in a moment. So, in fact, the next thing we're going to talk about is going to be risk management. So I like to think of risk management as being this on the very back end of our cycle. Risk management, while yes, we can see issues with the first 2 steps, primarily when we think about the HIPAA security rule, we need to focus on reducing the chances of breaches. All right, whether those breaches are intentional, whether they're accidental, whether they're just stemming from poor policy, we need to combat that. And most breaches actually do stem or originate from poor policies, poor procedures, poor enforcement of those policies, and just overall poor training of staff members. They're typically accidental, but accidental breaches can be very, very costly. Now, there are a lot of, I shouldn't say a lot, but there are some intentional breaches that do occur that involve more nefarious things, especially as you saw the recent rise in ransomware. But those, while potentially more severe because they will tend to affect more people, or at a minimum, they'll actually affect the practice to the point where it no longer has computers to use. Those are fewer and far between than are accidental. Somebody sends the patient letter to the wrong address, or somebody calls the wrong phone number to inform a patient of a test result, right? Those things are breaches in their own right, but risk management is kind of there to help mitigate that. And risk management itself should be thought of as its own cycle. And it's a pretty simple cycle. The first step of it is you really say, where are our weaknesses? What is potentially going to cause us problems in the future? And this can be something that's very difficult to do. This first step, identifying those weaknesses, oftentimes you may not know of a weakness until after the fact. And it's incredibly important that we explore every possible eventuality. Because as you see with the HIPAA tiered system, part of those tiers is how effective your risk management strategy actually is. So if you have a poor risk management strategy, you're going to be hit with a higher tier fine. If your risk management was just saying, oh, yeah, this currently works, nothing's ever going to come from this set of policies and procedures, well, you're going to be hit with a much greater fine. Now, on the other hand, you do an extensive risk analysis. You do everything you can based on that risk analysis results, and then a breach still occurs. The OCR will turn around and they will say, you know what? You did a very thorough risk analysis, and this is something potentially that no one would have ever thought would be possible. And you end up with actually much, much lower level fines when your risk analysis is very, very thorough and you take action on your risk analysis. So that's the difference between individual fines being under $1,000 or over $50,000 per individual fine. So with our first step of risk management, you really have to analyze and reflect and look through policies, procedures, technologies, and find the weak point. You find the weak point, and then your second step becomes, okay, how do we solve this weak point? How do we make it less of a problem? Your third step is you implement that change. When that change occurs, you have to then monitor that change and see if it actually is effective. Because a big part of risk management isn't just adding a new policy or procedure, it is ensuring that that policy or procedure is better than what previously existed. So that means you have to analyze data related to your risk management cycle. So you start to see now how these things really are integrating. Now, our very last step encompasses all of these. And that is going to be informatics. So I like to think of informatics as the last stage of everything, or a key part of everything, I should say. This stage is how we take the data from our data analysis. And remember, we've analyzed data related to everything. We're analyzing healthcare outcomes. We're analyzing claim revenue outcomes. We're analyzing risk management outcomes. Informatics is how we take that data analysis and actually apply it. Okay? So if we find that, if we had a breach and we did a root cause analysis and we determined that there's a certain policy that led to that breach, our data analysis tells us there was a problem. Informatics tells us, okay, how are we going to, it's going to basically say how we take that data and apply a change. And then that directly, again, ties into risk management as we're executing a risk mitigation tool. So essentially, you're trying to further reduce risk or prevent an adverse event of any kind to happen ever again. And all of these stages can also kind of be applied to healthcare as a whole, right? Risk management, we'll talk later about adverse events. And in general, an adverse event is anything that is a consequence of medical care that was never intended to occur. It could be something as simple as a fall. It could be errors in drug dosing. It could be, as you'll see in our discussion, wrong site surgeries. All of these things can despite not ever being planned, they can have severe consequences. What do you do when your 87-year-old patient that's hospitalized gets up in the middle of the night without letting their nurse know and slips and falls and breaks their hip? That's a major problem. Even though we have tools in place to help mitigate that, there's better things that can potentially be done. So informatics kind of takes all of our data and our current policies and procedures and basically says, okay, here's how we're going to change things, because the data says that doing it our original way is not as effective as doing it in this new way, which is, again, with risk management, why you always need to continue to monitor for risk. We can also take informatics into the claim revenue cycle. As I talked about before, when you're looking at issues with claims, issues with billing practices in general, you're going to want to, particularly for you guys at least, pay close attention to claim denials. Claim denials can be a pain. They're not the end of the world, but they just create excess work. And informatics will say, okay, we're seeing this pattern of problem when we're billing, this series of code. What data analysis will then say, okay, this is why we're seeing this issue. And informatics is kind of going to be okay, we're going to apply this change because the data tells us to apply this change, right? So if there were, for instance, a new code introduced, like we saw with COVID, we had a handful of new codes introduced specific to COVID. If they were suddenly being denied, well, why are they being denied? We have to analyze that. And then once we figure out, for instance, that maybe we're not meeting a certain criteria within the medical record, you then will apply a new policy that says, okay, we need to specifically mention this, or we need to specifically do this to ensure we can bill this code, right? That's basically what informatics is. It's taking all of our data and actually applying it to make changes. So those are essentially the 4 primary stages of the health information management cycle. And if you have any questions, please make sure to ask.